The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. How are you? Hope you are fine and having a good weekend. We're here talking about a lot of new news and cases, patients, and, of course, answering your questions. So we're live. Noah and Ed are running the studio. It's an immense, fantastic studio at WOR, and everything is on their shoulders. So if you want to speak or have a question or a point of view, please call us at 1-800-321-0710. That's the WOR studio number. Again, it's 1-800-321-0710. If you just want the booklet DVD, you can leave your name and address with Ed, and he'll pass it on, and we'll send it out in the morning. So we have a lot of things to talk about tonight, and going to try to make it through. We just had a story. Actually, my good friend Mitch, who I've known for 37 years, passed on this story to me, and the story kind of hits the point, if you know what I mean. Here's a story from Mitch, my friend, and he says I should tell this to all of you. A sweet grandmother telephoned the hospital. Timidly, she asked, "Is it possible to speak to someone to tell me how a patient is doing?" The operator said, "I'll be glad to help, dear. What's the name and the room number of the patient?" The grandmother said in her weak, tremulous voice, "It's Norma Finley, room 302. The operator replied, "Let me put you on hold while I check with the nurses' station for that room." After a few minutes, the operator returned to the phone and said, "I have good news. Her nurse just told me that Norma is doing well. Norma's blood pressure is fine. Norma's blood work just came back normal, and her physician has scheduled her to be discharged tomorrow." The grandmother replied, "Well, thank you. That's wonderful. I was so worried. God bless you for the good news." The operator responded, "You're more than welcome. Is Norma your daughter?" The grandmother said, "No. I'm Norma Finley in room 302, and no one tells me a thing." So if that's how you feel, you may want to think about coming to a different place where we deal with patients differently, where patients know what's going on, where patients have their documents. Yeah, it's a semi-humorous story. It's a true story, actually, and we would like to have less chaos and less confusion and more insight for every patient. We're a cancer treatment center. We're located at 1384 Broadway, and this is Dr. Lederman. I want to talk about some news, first of all, at the top of the hour. There's a new article that was just published, and it was published about men who've had vasectomies. This is news in that an article by Charlotte Bath in the ASCO Post has written that long-term results from health professional follow-up health study have shown a 20% increase in advanced cancer and a 19% increase in fatal prostate cancer in men who've had vasectomies. A urologist that was associated with the study said it's reasonable to advise men of the association between vasectomies and prostate cancer and tell them, if that's you, of the overall risk. So there's a significant increase in the fatal cancers of the prostate in men who have had vasectomies. So if that's you, you may want to get screened, of course. This study involved 49,000 men in the health professional follow-up studies. They were 40 to 75 years of age, and they were followed for up to 24 years. The vasectomy study was updated every 2 years, and actually 25% of the men, or 12,000, had vasectomies by the year 2000, and 6,000 men were diagnosed with prostate cancer. So there is a increased risk, substantial risk, and there's a marked increase in fatalities. So if you've had a vasectomy, it may give you double reason. Number one is you're a man, and number two, the vasectomy, to get checked up. Of course, you're welcome to come and see us or see your own doctor, whatever is most convenient for you. I want to talk about a woman who came, a case, but to me a case is a human being, and this is a human being from Utah, 70 years old. She came with her husband and daughter, a loving family. She was found in 2010 when she had a cough to have a mass in her lung. It was biopsied and found to be non-small cell cancer. She had surgery and did okay, and then the cancer came back in 2012 with lung and liver metastasis. Metastasis means the cancer spread through the bloodstream to those sites, the lung and the liver, and then to the brain. She had treatment at a big cancer hospital. She had actually about 2 years of treatment, and it didn't work. She had lots of numbness in her hands and feet from the chemotherapy. She's lost 20 pounds. She had a blood clot, and we've talked about that before, that blood clots are actually the number 2 killer of cancer patients. So just a warning, if you have a swollen leg or swollen legs and a diagnosis of cancer, you should certainly get checked up. It could be serious. Anyway, she came to us when the chemo wasn't working, and she wants a chance. Her function is excellent. So if you look at her walking down the street, she looks like a beautiful, healthy woman. On the other hand, she's got some spots that need treatment, and we're focusing in on the lung and the liver. There's a new study out that shows that people with lung cancer who are aggressively treated to the spots actually have a longer survival, some up to, on average, 5 years for treatment of what's called oligometastasis. Oligo is a word, fancy word for meaning small number of, up to 5, and metastasis is the spread of cancer. So there's a study out showing that people with lung cancer who have oligometastasis and who are aggressively treated, including treatment like radiosurgery, can have an average survival of 5 years, when with chemotherapy the survival is markedly less. And I want to talk about a gentleman who's 66. He comes with his wife every day for treatment. He had a Gleason 7 cancer. It started out with a Gleason 7, PSA 4.6. He was treated with robotic surgery at a big hospital in Manhattan, and the PSA went down. He was treated in 2011, went down to 0 for 2 years, and then has risen up to 0.16 and 0.27. Well, after surgery, the PSA should be 0.0 because the surgeon should have removed all the cancer and all the prostate. So there should be no more PSA. Well, obviously, his cancer is back. And what's the chance of that? Well, if you look at our prostate cancer booklet, you will see whether robotic or not robotic with surgery, The success rate for surgery in the best hands is about 60% for Gleason 7. With us, it's about 90% for a new diagnosed patient. So obviously, many men, when they hear that you can have a 50% better result coming to us, wish, of course, to check things out before surgery, either open or robotic or standard radiation, because 50% difference is a huge number. So this man, unfortunately, already had robotic. His cancer came back. There is data showing men who've had surgery and the cancer comes back do better and have a chance of long-term survival with focused beam radiation, and we were the first in America to perform focused beam radiation treatment at all, anywhere in the body, including the prostate. And we have a huge experience and a huge team that works together doing this kind of work. And speaking of that, I have another patient who came in this week, 63-year-old man who had a Gleason 8 treated with CyberKnife. Now, he was treated with CyberKnife, and as soon as the 5 CyberKnife treatments were done, his sex life was kaput, and he's urinating up to 4 or 5 times a night. So he's had a lot of drop in quality of life after CyberKnife treatment, and he came in actually not because of the impotence or because of the urinary problems after CyberKnife. He came because of flank pain and a mass around the ribs. So we're getting him tested up to find out what it is and to hopefully reassure him. But again, it's important not only to look at success rate, but quality of life, avoiding radical, and long-term data, of which I think we are the kings. I also want to talk about a woman. It's an interesting woman, 51 years old. She's postmenopausal. She had inflammatory breast cancer several years ago. Inflammatory means the breast looked inflamed, like red, hot, like it's infected. But it's not infected. It's all cancerous. Now, when I started training at Harvard Medical School in 1981, the data actually showed an average survival of about 6 months for women with inflammatory breast cancer. Well, treatment has evolved. There's better systemic treatment. There's better local treatment. She's now out more than 2.5 years, cancer-free. So I'm not talking about her breast cancer. So you may think, wow, she had inflammatory breast cancer 2 years ago. What's the problem? Well, actually, back then she had a meningioma, which is a benign tumor of the covering of the brain. Her oncologist have sent her, now that she's been in remission for this long, to have the meningioma treated. Meningiomas are benign tumors usually, not always. We have a large experience treating meningiomas with focused beam radiation. This woman did not want her head opened up. The success rate is very high in our hands, about 97%. So she's going through focused beam brain radiosurgery now, which is totally non-invasive. There's no screws in the head or pain, unlike other systems like the Gamma Knife system, which was a system that was developed about 50 years ago. She's getting treatment. She's doing great. Breast cancer is in remission. Cancer markers are in remission. And she's tolerating treatment exceedingly well. We're going to stop for just a moment. Again, this is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We deal with patients. We deal straight with patients. We answer your phone calls. We give you copies of your information, your CAT scans, your PET scans, your reports, so you can know exactly what's going on with you. We were the first in America to offer body radiosurgery and the first in New York with brain radiosurgery. And we're different in a good way. So here's a few voices that talk about our work, and then we'll be right back to answer your questions.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you